Hi, it's Christina with the Sisyphean Journal, and it's May 31st, and today I'm going to talk about um, a death from 1983 that typically it gets listed on pro-life lists of abortion deaths, although um, it's really unclear where the infection started that led to the heart problem that ended young Maureen's life. Um, from what I understand, the clinic did cooperate with the hospital. Um, they did behave in a responsible manner after she became sick. What the question is whether she was so sick at the time of the abortion that they should have referred her right away for help. So this isn't about so much whether an abortion killed Maureen as whether this was a case of inadequate screening. And we have seen cases before where it wasn't the abortion that caused the death, but the abortion clinic could have prevented the death if they had behaved like competent medical professionals. In this case, I haven't been able to find out enough to make a judgment. Um, is a case of Maureen, who was a 21-year-old woman from North Huntington, Pennsylvania, and she was in Florida visiting a friend in May of 1983 when she went to Aware Woman Clinic in Melbourne for a safe and legal abortion. It was performed by Dr. John Bayard Britton on Friday, May 27th, and he did note on her chart some anatomical abnormalities. About 24 hours after the abortion, she had nausea, vomiting, fever, chills. At about 11 o'clock on Sunday morning, Maureen's friend called the clinic and said, that her friend was very ill. And I have to credit them. They had somebody there to take the call. It wasn't like, what's his name, Carhart, where Jennifer Morbelli's family's trying to reach him and they get the answering machine for his wife's equestrian supply business. They did provide Maureen and her friend with a phone number where they actually could reach somebody. So credit where credit is due. That was responsible, and they did tell her to go directly to the emergency room. So credit where credit is due there. That was a case of due diligence, and I appreciate that. When she was admitted to Holmes Regional Medical Center, she had a fever and chills, was extremely weak. Her blood pressure was very low, and her skin had turned a very unhealthy blue-gray color from lack of oxygen. Then doctors at the hospital contacted the clinic, and from what I understand, they did immediately provide a copy of her records. And what's unfortunate in this case, this is kind of the opposite of what happened with Edrika Good. With Edrika Good, nobody in her family knew about the abortion, and therefore the hospital didn't look for anything abortion related when they were treating her. They actually thought it was a psychiatric problem because she was so irrational because her brain had been damaged by septic shock. In this case, because they knew she'd had an abortion, they performed a complete hysterectomy to remove what seemed to be the source of the infection. I haven't been able to find out whether there actually was any infection in Maureen's uterus. If there was, then that might have been the source of the fatal sepsis. But in spite of the hysterectomy, Maureen suffered septic shock and died at 4:15 the morning of May 31st. And the medical examiner said the intensity of this myocarditis should have indicated that the young woman was very ill, and there should have been some signs or symptoms of serious illness at the time she was being prepped for the abortion. And that's where the question comes up, whether she was adequately screened, whether she was high risk and they shouldn't have been doing an abortion in an outpatient setting, or whether, it was high risk and they should have referred her to somebody for this infection. And again, I don't have enough information to know. This isn't a clear-cut case of this clinic was in the wrong. So, on the 10th anniversary of Maureen's death, her father spoke to Florida Today and expressed regret that she hadn't told him of her plans for an abortion. He said, "I'm sure she would not have gotten into that situation." Maureen had been raised in a pro-life Catholic family, and the family did not object to pro-lifers commemorating the anniversary of Maureen's death. But her father said, I hold society responsible and the clinic is part of it. The clinic is in a business to make money. That's their intention. Their interest is not people. But again, in the case of this particular clinic, it's really hard to say. There is no clear cut, as was the case with Vanessa Preston, where it seems pretty clear cut that the clinic did behave very responsibly and did everything they should have done. This is a case of who knows, but it really was sad. And because there's no indication of how sick she was when they started the abortion, we don't know whether they could have spotted that, referred her to somebody, and prevented this death.